Welcome everyone. I'm excited to welcome you to today's presentation. Today, we'll be exploring diseases of the genitourinary system, specifically codes N00 to N99. This session will cover key aspects of these conditions, their diagnosis, and classification. So stay with me as we dive into this important topic. Let's get started. Let's start by looking at the introduction to the genitourinary system. This system is quite vital as it includes the male and female genital systems, as well as the urinary system. Understanding its anatomy is crucial because it helps us accurately code various diseases and conditions. Today, we'll explore the structure of these systems and go over some key coding guidelines. By the end of this, you'll see how these guidelines help ensure precise documentation and billing, which is essential for effective healthcare management. So, let's dive into the details of these interconnected systems and their significance in medical coding. Let's take a closer look at the anatomy of the urinary system. The human urinary system, also known as the renal system, is made up of four main organs: the kidneys, ureters, bladder, and urethra. These organs work in harmony to perform several vital functions. First, they filter the blood to remove waste products and excess fluids, which results in the production of urine. This urine is then stored in the bladder until it's time to be eliminated from the body through the urethra. Now, focusing on the kidneys, these are bean-shaped organs located near the lower back. Their primary role is to filter waste and excess fluid from the blood, which is essential for maintaining a healthy internal environment. But their function goes beyond just filtration. The kidneys also help regulate blood volume, blood pressure, and the balance of electrolytes in our body. Additionally, the kidneys produce important hormones. For example, erythropoietin, which stimulates the production of red blood cells, and calcitriol, which helps regulate calcium and phosphorus levels. Understanding these functions highlights how integral the kidneys are, not only in waste removal, but also in maintaining overall systemic balance, tying directly into our broader discussion on how the body keeps itself in equilibrium. Let's take a closer look at the anatomy of the urinary system. Starting with the ureters, these are two narrow tubes that carry urine from the kidneys down to the bladder. They use smooth muscle contractions, kind of like rhythmic waves, to push the urine downward, away from the kidneys. Next, we have the bladder, which is essentially a muscular, expandable sac. Its main job is to store urine until we're ready to urinate. The bladder wall relaxes and stretches to hold the urine, and when it's time to go, it contracts to expel the urine out of the body. Moving on to the urethra, this is the tube that carries urine from the bladder and out of the body. Interestingly, it's longer in males than in females, which has implications for things like infections and urinary flow. Finally, we have the sphincters. These are two sets of muscles that control urination. The internal sphincter, located at the base of the bladder, stays closed until the brain signals it to relax, allowing urine to flow. The external sphincter at the end of the urethra can be consciously controlled, so we can delay urination until it's appropriate. Understanding these components helps us see how the urinary system functions smoothly to maintain our body's fluid balance and waste removal. Let's take a closer look at the anatomy of the kidneys. The kidney is covered externally by a tough, protective layer called the renal capsule. Inside, it has a more complex structure, divided into the cortex and medulla. The kidneys are situated behind the peritoneum, which is why we say they are retroperitoneal, on the posterior side of the abdominal wall. Focusing on the renal cortex, the outer layer, this area houses the nephrons, the vital functional units responsible for filtering blood. Moving inward, we find the renal medulla, which contains the renal pyramids. These pyramids are cone-shaped structures that actually hold more nephrons, helping with the filtration process. The pyramids are separated by extensions of the cortex called renal columns, which help support and organize the internal structure. Within the kidney, urine is collected in a funnel-shaped structure called the renal pelvis. From there, minor calyces collect urine directly from the tips of the pyramids. These minor calyces then drain into larger, major calyces, which gather urine from multiple minor calyces before funneling it into the renal pelvis. Now, let's discuss the blood supply. This is crucial for understanding how the kidney functions. The renal artery delivers oxygen-rich blood into the kidney, supplying the necessary nutrients. Once the blood is filtered, it exits through the renal vein, carrying away the cleaned, filtered blood. It's interesting to note that the kidneys are highly vascularized. They receive about 25% of the cardiac output at rest, highlighting their importance in maintaining overall body homeostasis. Let's take a closer look at the renal hilum. It's a deep vertical fissure on the medial border of the kidney, and it serves as the main entry and exit point for essential structures like blood vessels, nerves, and the ureter. Understanding this helps us see how the kidney connects to the rest of the body's circulatory and urinary systems. Now, moving on to the nephron, which is the functional unit of the kidney. Think of it as the tiny workhorse that actually filters blood and produces urine. The nephron is made up of two main parts, the renal corpuscle and the renal tubule. Starting with the renal corpuscle, this is where the magic of blood filtration begins. It consists of the glomerulus, a network of tiny capillaries where blood plasma is filtered out, and Bowman's capsule, a cup-shaped structure that surrounds the glomerulus. Bowman's capsule collects the filtrate. Think of it as the initial processing stage before the filtrate moves further along the nephron. Next, we have the renal tubule, which is a long, winding tube responsible for processing that filtrate. It includes the proximal convoluted tubule, the loop of Henle, which has descending and ascending limbs, and finally the distal convoluted tubule. Each segment plays a specific role in reabsorbing nutrients and water, and in secreting waste products, refining the filtrate into urine. Finally, the collecting duct is the last part of the nephron. It's where the processed filtrate, now urine, is collected from multiple nephrons. From here, the urine is transported to the renal pelvis, ready to be drained into the ureter and eventually eliminated from the body. Connecting all these points, understanding the structure and function of each part of the nephron helps us see how the kidney efficiently filters blood, maintains fluid and electrolyte balance, and removes waste, all vital for overall health. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the anatomy of the female genital system. The female genital tract is divided into external and internal structures, and today we'll focus on the external genitalia, also called the vulva. Starting with the mons pubis, which is a fatty tissue layer that covers the pubic bone. It provides cushioning and protection for the underlying structures. Moving downward, we see the labia majora, which are the outer folds of skin that protect the vulva and help shield the internal organs. Inside the labia majora are the labia minora, the inner folds of skin that surround the vaginal and urethral openings. These structures vary in size and shape from person to person, but are crucial in protecting the more delicate internal tissues. At the top of the vulva, you'll find the clitoris, a highly sensitive erectile organ. It's rich in nerve endings and plays a significant role in sexual pleasure. Moving downward, the vaginal opening serves as the entrance to the vagina itself, often covered partially by a thin membrane called the hymen. Next, we have the urethral opening, which is the opening for the urethra, the tube that carries urine out of the body. It's located just below the clitoris and above the vaginal opening. On either side of the vaginal opening are the Bartholin's glands. These glands produce mucus that helps lubricate the vulva, especially during sexual activity. Similarly, Skeen's glands are located around the urethra and also produce mucus, playing a role in lubrication and overall health of the area. Understanding these structures is fundamental as they work together not only for reproduction, but also for protection, sensation, and overall well-being. Let's take a closer look at the internal female genital system. First, we have the vagina, which is a muscular canal that connects the external vulva to the cervix. It's an important passageway for menstruation, intercourse, and childbirth. Moving upward, The cervix is the narrow, lower part of the uterus that links it to the vagina. It acts as a gateway, playing a key role in fertility and protecting the uterus from infection. Next, we have the uterus itself, often called the womb. It's a pear-shaped organ where a fetus develops during pregnancy. Its structure and function are vital for supporting fetal growth. Connecting the ovaries to the uterus are the fallopian tubes. These tubes are where fertilization typically occurs when a sperm meets an egg. They also serve as pathways for the eggs to reach the uterus. Lastly, the ovaries are small glands located on each side of the uterus. They produce eggs, or ova, and secrete hormones like estrogen and progesterone, which regulate the menstrual cycle and support pregnancy. Understanding these internal structures helps us appreciate how the female reproductive system functions as a coordinated and complex system essential for reproduction. Now, let's take a closer look at the anatomy of the male genital system. The male reproductive system consists of both internal and external organs that work together to facilitate reproduction. Starting with the internal organs, we have the testes. These are located in the scrotum, which is the pouch that hangs outside the body. The testes have two main functions. They produce sperm, which are the male reproductive cells, and testosterone, the hormone responsible for male secondary sexual characteristics. Connected to each testicle is the epididymis, a coiled tube where sperm mature and are stored until ejaculation. Next, we have the vas deferens, a muscular tube that transports sperm from the epididymis to the ejaculatory ducts during ejaculation. Moving on, behind the bladder are the seminal vesicles. These glands produce a sugar-rich fluid, mainly fructose, which nourishes the sperm and provides energy for their journey. Surrounding the urethra is the prostate gland, about the size of a walnut. It produces a fluid that becomes part of semen, helping to protect and support the sperm. On the sides of the urethra are the bulbourethral glands, also known as Cowper's glands. They produce a small amount of fluid that lubricates the urethra and helps clean it before ejaculation, reducing friction. The ejaculatory ducts are formed by the union of the vas deferens and the ducts from the seminal vesicles. These ducts pass through the prostate and empty into the urethra, which is the final passageway. The urethra serves a dual purpose. It carries urine from the bladder and semen from the ejaculatory ducts out of the body during ejaculation. Understanding these internal structures highlights how intricately they work together to support male fertility and reproductive health. This knowledge is essential as we explore the overall function and health of the male reproductive system. Now, let's take a closer look at some of the external organs involved in male reproductive health. First, we have the scrotum. This is essentially a pouch of skin that holds and protects the testes. One of its key roles is to regulate temperature, which is critical for healthy sperm production. The scrotum can adjust its position, moving closer to the body or farther away, to keep the testes at the optimal temperature. Next, we have the penis, which is the external male sex organ. It's not only important for reproduction, but also plays a vital role in the excretory system by allowing urine to be expelled from the body. Both of these organs are essential in the overall reproductive process, and understanding their functions helps us appreciate how the male reproductive system is designed for both protection and function. Remember, these external organs work together with internal structures to ensure fertility and reproductive health. Let's talk about chronic kidney disease, or CKD. Essentially, CKD is diagnosed when there's either signs of kidney damage or a significant decrease in how well the kidneys are filtering, specifically a GFR less than 60 ml per minute per 1.73 square meters, and this has to last for at least 3 months. This duration is important because it distinguishes chronic issues from temporary problems. Now, when we look at what causes CKD, the most common culprits are diabetes and high blood pressure. These conditions put extra strain on the kidneys over time. But it's not just those. Autoimmune diseases, certain genetic disorders, and infections can also contribute to the development of CKD. It's crucial to understand that CKD is a progressive disease. This means that kidney function gradually declines over time, often without obvious symptoms in the early stages. As the disease progresses, the damage becomes more severe, which underscores why early detection and management are so vital. CKD isn't just one condition. It's classified into 5 stages based on how much kidney function has been lost and the extent of damage. Recognizing these stages helps guide treatment and management strategies to slow down progression and address complications. All of these points come together to emphasize why understanding CKD is key in the broader context of kidney health and overall well-being. Now, let's look at the different stages of chronic kidney disease. Stage 1 is where the kidney damage is actually the least, and the kidney function is still at its highest level. In fact, in this stage, the eGFR, or estimated glomerular filtration rate, is 90 ml per minute per 1.73 square meters or even higher. So even though damage might be present, the kidneys are still functioning quite well. Moving on to stage 2, we see a mild reduction in eGFR, which drops to between 60 and 89. This indicates some decline in kidney function, but it's still relatively mild. In stage 3, the reduction becomes moderate, with eGFR values between 30 and 59. This is a clearer sign that the kidneys are not working as well as they should be. Then, in stage 4, the reduction is severe, with eGFR falling between 15 and 29. This is a critical point where kidney function is significantly compromised. Finally, stage 5 is kidney failure, where the eGFR drops below 15, or the patient may require dialysis or a transplant to survive. Understanding these stages helps us see the progression of kidney disease and underscores the importance of early detection and management to prevent reaching the most severe stage. Let's talk about chronic kidney disease, or CKD. In its early stages, it often doesn't show any noticeable symptoms, so many people might not realize anything is wrong. However, as the disease progresses, symptoms can become more apparent. You might experience fatigue, swelling in your feet and ankles, and changes in how often you urinate. These signs can serve as important clues to seek medical advice. Now, CKD doesn't just stay isolated. It can lead to other health problems. For example, it increases the risk of heart disease, high blood pressure, anemia, and even bone issues. These complications highlight how interconnected our body's systems are and why managing CKD is so crucial. Regarding treatment, the main goal is to slow down the progression of the disease and manage any related conditions. When kidney failure occurs, treatment options like dialysis or a kidney transplant may become necessary. These interventions can significantly improve quality of life and help manage symptoms effectively. Overall, understanding these aspects helps us see the importance of early detection and comprehensive care in managing CKD, which ties into our broader discussion on maintaining overall health and preventing serious complications. When coding for chronic kidney disease, it's essential to accurately reflect the documented stage of CKD using the correct ICD-10-CM code. This helps ensure proper documentation, billing, and treatment planning. If both CKD and end-stage renal disease are documented, you should only code for ESRD. Let's go over the coding for CKD stages. For stage 1, the code is N18-1, indicating early-stage CKD. Stage 2, which is considered mild, is N18-2. Moving to stage 3, which is moderate, the codes are N18-30 when unspecified, N18-31 for 3A, and N18-32 for 3B, reflecting the severity within stage 3. For stage 4, which is severe, the code is N18-4. Stage 5, which is kidney failure, is N18-5. When the condition progresses to end-stage renal disease, the code is N18-6. Lastly, if the stage isn't specified, you use N18-9. The key takeaway here is to always select the most precise code based on the documentation, especially distinguishing between stages, as this impacts patient care and reimbursement. Proper coding reflects the severity of the disease and ensures consistency across medical records. Let's go over some important coding guidelines for CKD. specifically for cases involving hypertension, diabetes, and kidney transplants. First, in hypertensive CKD cases, when both hypertension and CKD are documented, we need to code from the I-12 category first. That's the code for hypertensive chronic kidney disease. After that, we follow with the appropriate N18 code that indicates the stage of CKD. For diabetic CKD, the key point is that when a patient has both diabetes and CKD, we should code the specific diabetes code that reflects diabetic kidney disease. For example, E1122 for type 2 diabetes with diabetic kidney disease. Then, we also assign the correct N18 code for the CKD stage. Now, when it comes to kidney transplants, if a patient has had a transplant, we use the code Z9040 to indicate the transplant status. And if the patient with a transplant also has CKD, we need to first code the CKD stage, and then add Z9040 afterward. These guidelines help ensure that our coding accurately reflects the patient's clinical picture and supports proper documentation and billing. Remember, the order of codes and the specificity are crucial for correct coding. When it comes to coding for chronic kidney disease, there are a few important points to keep in mind. If the patient is on dialysis, you should use the code Z992, which indicates dialysis status. This helps to clearly identify that the patient requires ongoing dialysis treatment. Now, if a patient has both hypertensive chronic kidney disease and an acute renal failure, the correct approach is to code I-12 first, since it reflects the hypertensive CKD. Then, you would add the appropriate N18 code to specify the stage of the CKD. Additionally, you need to include a separate code for the acute renal failure itself. And what if the stage of CKD isn't documented? In that case, you should use N189, which stands for unspecified chronic kidney disease. This ensures that we're still capturing the presence of CKD even when specific staging information isn't available. These coding rules are essential because they help communicate the patient's condition accurately and ensure proper documentation and billing. They also connect back to our broader goal of precise clinical coding, which supports better patient care and data analysis.